What's up, respiratory world? This is our Ballard. This is our endotracheal tube Ballard. 21 inches. So something that we have to be well aware of is that we have an endotracheal tube Ballard as well as endotracheal tube Ballard as well as a tracheostomy tube Ballard. And sometimes when we have to intubate, this here hospital I'm at now, we do have to intubate the patient sometimes. So you don't want to grab an endotracheal tube Ballard for a tracheostomy patient, and you don't want to grab a tracheostomy tube Ballard for an endotracheal tube patient, because when you go to suction the patient, you're gonna go down and meet some resistance. You're gonna have much more, like I've had ventilators set up before where we had a tracheostomy tube patient, and you put an endotracheal tube Ballard on there, which is 21 inches, and you go down there, you meet the resistance, and you have all this extra tubing left. And sometimes when you suction into patients, you have to pull all of the tubing out of the airway, out of the airway, because you will start reading high pressure, and the patient will have some difficulty breathing because they have extra resistance in the airway, so they are unable to breathe around, you know, the suction tube still being in the Ballard. So, you know, we'll make sure that we have the correct size endotracheal tube for the correct size artificial airway. So you'll make sure you have a tracheostomy tube Ballard for trach patients, which is 12 inches. And you'll make sure you have an endotracheal tube Ballard for endotracheal tube patients, which is 21 inches. That's nothing like having a cold on the patient. You intubate the patient, you have a tracheal tube Ballard, you're trying to suction the patient. You can't get all the way down to the carina because you're going to do so much dead space. You get into just somewhere in the mouth, or right past the, you know, it's not getting down to the carina to suck the secretions out. So you're trying to suction the patient, but you can't suction them because you are just in the tube and you're not getting down to the lungs. So we have had that issue before. Like, you know, as soon as you intubate the patient, you want to, you know, try to suction them and clear the airway. But if you got a tracheostomy tube Ballard, it's not going to work quite right. So, you know, just make sure we got the right size Ballard for the right artificial airway. But yeah, I've had ventilators before, whereas though, you know, we there's this little window, you probably can't see it, and there's this little black dot on the window. So you want to make sure the black dot is fully pulled back out of the window so they won't meet any resistance, and you won't get high pressures, because, you know, the nurse will call you and say, why is the patient choking? And you're like, let me check. And you check the Ballard, and you see that you know, the black pieces in the window, so the patient is getting some resistance in the flow. So there you know.